You've been told you have sciatica, but do you actually know what that means? And more importantly, what you should do about it? Welcome back to this series on low back pain. Drop a comment below if you're currently dealing with sciatica and how long you've had it. You know that sharp, shooting pain down your leg can be incredibly scary, right? And the word sciatica gets thrown around constantly, but honestly, it's so often misunderstood, and that can lead to a lot of unnecessary fear and confusion. So today we're going to cut through all that noise. We're going to break it all down using the best science we have to give you some real clarity and a clear path forward. If you haven't watched my video on disc bulges yet, I'd start there. Link is in the description. Okay, so here's our roadmap for this explainer. First, we're going to figure out what sciatica really is. Then we'll look at what's actually causing the pain. After that, and this is my favourite part, we'll talk about your body's amazing ability to recover. Then we'll get into the practical stuff, what actually helps it heal. And finally, we'll cover the really crucial signs that tell you when you need to get urgent help. Alright, first things first, let's tackle the big one. The word sciatica is probably one of the most misused terms in all of medicine when it comes to back-related pain. So what on earth is it really? Okay, so this right here is the most important clarification. Sciatica is not a diagnosis. It's not a thing you have. It's just a word to describe a symptom. And that symptom is pain that travels down the path of your sciatic nerve, which is this huge nerve that runs from your low back down through your buttock and all the way down your leg. And here's the real hallmark sign. The leg pain is the main event. It's almost always way worse than any back pain you might be feeling. Now this is a super important distinction, because not all pain that goes down your leg is true sciatica. We need to separate what we call radicular pain from referred pain. So radicular pain, that's the real deal. It's caused by a nerve root getting directly irritated. Think of it like a sharp electric shooting pain that travels in a pretty clear line, often right past your knee. Referred pain, on the other hand, is different. It's coming from other parts of your back, like the joints or the discs themselves. It's more of a dull, deep, achy feeling that's kind of hard to pinpoint, and it usually stays up in the buttock or thigh. A lot of people who think they have sciatica actually have this referred pain. And to get even more specific, let's decode these terms you might hear from your doctor. Radicular pain is the symptom. It's what you feel. It's that sharp, radiating pain. Radiculopathy is different.
That's an objective finding. It's what a clinician finds during an exam. It means the nerve isn't working quite right, which might show up as numbness, muscle weakness, or maybe a change in your reflexes. And here's the kicker. You can have terrible pain without any signs of radiculopathy, and you can also have radiculopathy without feeling much pain at all. They don't always go together. Okay, so if you do have that true nerve irritation, what's causing it? Let's get into the mechanics here, because it's not always what you think, and it's definitely not always as scary as it sounds. So who are the usual suspects? Well, in about 90% of cases, the main culprit is a disc herniation in your lower back. This is where a little bit of that soft, jelly-like center of a spinal disc pushes out and just plain irritates the nerve next to it. Other causes could be something like spinal stenosis, which is just a narrowing of the canal your nerves live in, or less common things like one bone slipping forward on another, or even a muscle in your hip called the piriformis bothering the nerve as it passes by. But listen up, because this is probably the single most important idea we're going to cover. This quote from a major clinical review says it all. Whatever a scan like an MRI shows has to match up with what you're actually feeling. Why? Because we now know for a fact that things like disc herniations are incredibly common in people who have absolutely zero pain. Just look at that number, 36%. Let that sink in. More than a third of people over the age of 40 just walking around living their lives completely pain-free have a disc herniation that would show up on an MRI scan. So an image by itself doesn't tell the whole story, not even close. It's just one piece of a much bigger puzzle. This is why you should never, ever panic just because you read a scary-sounding MRI report. And all of this leads us to the most hopeful and honestly the most empowering part of this entire explainer. Your body has an amazing, incredible capacity to heal itself. The research on this is just overwhelmingly clear. For most people, the natural course of sciatica is really, really good. Just look at this timeline. Within just 2 weeks, about a third of people are already feeling better. By that 6 to 12 week mark, the vast majority of people feel a whole lot better. And by 3 months, about 3/4 of people are pretty much recovered. Your body is incredibly resilient. So how in the world does this happen? Well, it's not magic, it's biology.
Yeah, your body actually sees that little piece of herniated disc as a foreign invader, so it mounts an immune response. It sends in a cleanup crew, basically. And over time, that process can actually shrink or sometimes even completely reabsorb the bit of disc that was causing all the trouble. And hey, don't just take my word for it. This isn't some fringe theory. This quote comes from a huge systematic review. That's a study of all the other studies, and it confirms that this process, what they call spontaneous reabsorption, is a well-documented real thing. Your body is designed to heal. Okay, so knowing that your body is already on the job working hard to heal itself, what can you do to help it along? Let's look at what the evidence actually says works. The foundation of modern smart care really rests on 3 pillars. Number 1, stay active. The old advice to lie in bed for weeks is totally out. We now know that gentle movement is your friend. Number 2, progressive loading. This just means you gradually and gently get back to doing your normal activities and exercises, letting your symptoms be your guide. And number 3, and this one is huge, pain education. Simply understanding that hurting doesn't always mean you are harming yourself can dramatically reduce fear and help you recover faster. And this really is the modern clinical consensus. Those passive treatments, like bed rest, have been totally replaced by an active approach. The game plan now is that for the first 6 to 8 weeks, you focus on managing things conservatively and just give your body the time and the right environment it needs to heal. So what about all the other treatments you hear about? Well, this table kind of breaks it down. Staying active with some guidance from a physio, that's the foundation. Pain meds like NSAIDs, they might give you a little bit of short-term relief. Steroid injections, they can also give some people temporary relief, but the long-term benefit is a bit murky. And then there's surgery. Now, look at that column. It definitely offers the fastest pain relief.
But the really fascinating part is what happens when you look at the long-term outcomes. And here's the punchline. When you look at people 1 or 2 years down the road, the folks who had surgery and the folks who recovered with conservative care often end up in the exact same place, feeling good and getting on with their lives. So surgery is absolutely a valid option if the pain is severe and not getting better. One of the biggest studies ever done on this, the SPORT trial, followed hundreds of patients and found that most people who avoided surgery ended up in the same place as those who had it, just by taking a little more time to get there. But it's really a choice about the speed of your recovery, not necessarily the final destination. Now, while the outlook for most sciatica is excellent, we have to talk about the very rare but very serious situations where you absolutely must seek immediate medical help. We need to talk about the red flags. So, what are the signs of a true spinal emergency? We're talking about a specific condition called cauda equina syndrome. It's caused by severe compression of that whole bundle of nerves at the very bottom of your spinal cord. I need you to listen very carefully to this slide. The key signs are numbness in what we call the saddle area, so the parts of your body that would touch a horse's saddle. Any new and sudden problems with controlling your bladder or your bowels, like you can't go or you can't stop yourself from going. And finally, significant weakness that's getting worse in both of your legs. Let me be perfectly 100% clear. If you experience any of those symptoms, you do not wait. You don't call your doctor for an appointment tomorrow. This is a true medical emergency. You need to go to the nearest emergency department right away. But, and this is so important to remember, for the vast, vast majority of people, that emergency scenario is not their story. The real story of sciatica is that it's a temporary, and yes, very painful, condition that gets better. Your body is strong. It's designed to heal. The evidence all points towards taking an active, a patient, and an informed approach. So the final question is really for you. Knowing all this, how will you choose to partner with your body and focus on what you can do right now to get back to living your life?